Dr. Sundeep, Dr. Shaloo, if you can switch your cameras on, we're going live. Good morning, ladies and gentlemen, my distinguished panelists and all the viewers. I'm Dr. Nishant Sharma, and I welcome you back to another episode of this series of virtual discussions on arthritis in India, a nationwide dialogue. This series is a joint initiative by Voice of Healthcare and Pfizer, where we talk about the different innovations, the different management strategies, and the different talks about arthritis and its care in India. We will be talking in depth about understanding arthritis, the different types of arthritis, the management strategies, how a diagnosis is made, what are the prevalences, about public health initiatives, and some measures of prevention. So without further ado, allow me to welcome my experts. We have with us today Dr. Shaloo Bhasin Gagneja, Director Rheumatology at Primus Super Speciality Hospital, Delhi. Good morning, Dr. Shaloo.
Hello, good morning.
Thank you. We have with us Dr. Sandeep Kumar Upadhyaya, Professor and Senior Consultant, Rheumatology and Immunology, Indraprastha Apollo Hospital, Delhi. Good morning, Dr. Sandeep. Thank you for joining. And we have with us Dr. Neeraj Gupta, Senior Consultant, Spine Surgeon, Indian Spinal Injury Center, New Delhi. Good morning, Dr. Neeraj. Thank you for joining. And we also have Dr. Shruti Bajad, Consultant Rheumatology at Moolchand Hospital, Delhi. She'll be joining us shortly. So without further ado, I'll start this discussion around understanding arthritis. So my first question is going to be for Dr. Shaloo. Hi, Dr. Shaloo. I hope I'm audible to you.
Yes, please.
Yes. So for everyone who has joined, for all our viewers, let's try to set up the theme for the conversation. Let's try to understand arthritis. So my question to you will be, could you provide an overview of what arthritis is and the different types of arthritis that are prevalent in India?
Right. Hi. Okay, so I'll start off. What is arthritis basically? Arthritis is by definition pain and swelling in the joints. So this is basically a symptom which is telling us that there is an underlying disease which is manifesting as joint pain and swelling, right? There are around 100 kinds of causes of arthritis if we really look into each and every, including the rare causes. So if there is pain and swelling of any joint, we should look for other symptoms and signs to reach a diagnosis, like what is the disease. The most common cause of arthritis is rheumatoid arthritis, which is seen in around 1% population. So the prevalence is quite high. It is seen more in females, generally at the age of around 35 to 55. That is the range. And this is the arthritis which people generally know about. So if anybody has pain or swelling, they think they have rheumatoid arthritis. In the normal language, they say gathia bai. So rheumatoid arthritis is basically there's pain and swelling that starts in the smaller joints, and then this can spread to other joints. There is early morning stiffness, and which gets better by the day, and gradually, if not treated, it can lead to permanent deformities. So this is one of the most common. Coming to males, the most common inflammatory arthritis is gout, which is in India around 0.5% population. The prevalence is around 0.5%. This is generally seen in more than 50 years of age males. Gout is basically arthritis because of increased uric acid levels. Now, this generally presents as pain and swelling in a single joint, and it is a excruciating kind of a pain that makes the person handicapped for the initial first 2 or 3 days, and it is episodic. Then we have other kinds. We have connective tissue disorders, in which lupus, which is again seen more common in females. Here again, the disease can present as arthritis, that is pain and swelling in the joints. But there are other symptoms such as malar rash, oral ulcers. There can be involvement of the kidney. You can have frothing of the urine, which is a symptom of increased protein in the urine. There can be difficulty in breathing. So, and then there is systemic sclerosis, in which the skin is involved. There is skin tightening. There is difficulty in opening the mouth. Then we have vasculitis, in which basically there's inflammation of the vessels. This is a dreadful disease. It has a high mortality. This can also initially, for some years, many people just have pain and swelling in the joints, and later on, it can present with sudden bleeding from the mouth. There can be blood in the cuff, and which is life threatening. Basically, there is diffuse alveolar hemorrhage. So, these are some of the relatively common arthritis. And so, as I said, the arthritis is just a warning sign that yes, you have an underlying disease, and you should visit your doctor to see what kind of disease you have so that you are more vigilant, you take the proper treatment, and you can avoid the complications.
Right. Thank you, Dr. Shaloo, for that wonderful explanation and introduction for this session. Moving on, my next question will be in continuation to this. So I welcome Dr. Shruti as well. Hi, Dr. Shruti. Good
Thank you, sir.
morning.
Hi.
Good
Good
morning.
morning. Good
We were
morning. Yeah.
just discussing with Dr. Shaloo about what arthritis is and some common prevalent types of arthritis that are present in India. Moving the conversation towards you, let's talk about some signs and symptoms. Being a clinician, the signs and symptoms that you have very commonly seen patients presenting themselves with, and also talk about some key risk factors that are associated with this condition. Over to you, Dr. Shruti.
Yeah. Thank you so much, sir. And see, ma'am has already covered, what all types of arthritis are prevalent here. So, since the session is meant for general viewers, I'll be telling how to identify, that you may be suffering from arthritis. So, the first common symptom that a layman would perceive would be pain. If there is pain in the joint, especially the hand joints or knee joints, then it's an alarm sign that you should at least monitor it and not ignore it. The other thing is, if it is accompanied by stiffness of the joint, especially when the stiffness is early morning or it comes after rest, then you should look that, you should not ignore it. Fine. The other thing is there can be fatigue. The patient, a lot of patients, they tell that there is a persistent fatigue. They don't like getting out of bed. They don't have the energy. So there's a feeling of malaise that keeps on lingering through the entire day. Sometimes, patients, they tell that they feel feverish all the time. The other important thing that I would like to tell viewers is that if like this is your hand and you're not able to clench your fist, whenever the movement, there is decreased range of motion. If you are able to do like this, but then you stop here and you are having a difficulty, this is a red flag sign. So in any joint, if you ever feel that you are not able to have a full movement on that joint, you should look for it. And the other common symptom that people would see would be bony outgrowths. Like if you're having some bony outgrowths or you are feeling that your hands are becoming lumpy and bumpy, then you should look for arthritis. There can be numerous signs, but for the more layman thing, for the more common public, these will be the major signs. Other rare ones is what I would like to mention would be dryness of eyes or mouth. If you have a prolonged fever, which is not fitting into a category, or a doctor is not able to treat you, are just getting it for 3 months or so, you're losing weight, then you should have an evaluation for arthritis and autoimmune disease. And
Thank you.
when it comes to a little bit of, yeah, sure.
Risk factors. Right, Dr. Shruti, please.
Yeah. So there can be so many risk factors, but I'll just touch on a few. First thing is if you ever have a family history, people with malignancies, they'll be very aware. Like if your mother had a CA breast or something, they will get themselves really checked again and again. So if you have a family history of arthritis, you should be more vigilant. Like we are with other diseases, I see patients, if their father is diabetic, even if they are not diabetic, they'll come and get them checked themselves every month. So same applies to arthritis also, right? So if you have got these tricky genes, so you need to be little more vigilant about it. Females are generally more affected than males. So if you are the fairer sex, please take care of yourself. Other important thing that most of the people ignore is that if you had a previous joint injury, because that the joint becomes weak, so it is more prone for wear and tear and other things. And the other, everyone knows obesity. So if you are a little bit on heavier side, try to lose weight. And one other thing that a lot of people ask is cigarette smoking. So cigarette smoking can exacerbate a lot of arthritis, especially rheumatoid and ankylosing spondylitis. So you can actually keep that for occasions and not be a regular smoker. That's it. There are many others, but these are the prime ones that need everyone's attention. Thank you.
Thank you, Dr. Shruti, for putting light on the common symptoms and signs and the risk factors. Moving over, Dr. Sundeep, am I audible to you? Are you there? Hi.
Yes.
Thank you.
Yes.
As we have discussed about what arthritis is and the common signs and symptoms, I'd like you to emphasize on the diagnosis that a clinician makes and how do we reach the space of making a conclusive decision that a patient has arthritis. Over to you, Dr. Sundeep. Yeah.
So even as we speak, hundreds of patients must be approaching their doctors with a report that says there is arthritis. Uh, People who go to a yoga session will be given this diagnosis: you have arthritis, and so on and so forth. So the diagnosis of arthritis is something that a trained physician, a rheumatologist, an orthopedic surgeon, or a physician uh, makes on the basis of the history, the kind of problems that the patient has, and the presentation, what actually is showing up on the area that is painful or tender. Uh, Looking at X-rays, looking at MRIs, and also evaluating sometimes what are called the rheumatoid factor, the HLA-B27, and a lot of other things that have in the diagnosis built in a set of parameters that say three parameters are consistent with the history. Patient has A, B, and C problems, and the tests show D, E, F, and the ABC matches with D, E, F, then this is arthritis. Most of the times, the diagnosis is made by just speaking to the patient by a professional and looking and examining the patient. The tests actually make up only 10 to 20% of the diagnostic confirmation. And therefore, spending time with the specialist, the arthritis specialist, the rheumatologist, is most important rather than getting tests done. And those tests that I just will want to reiterate are various rheumatoid factor, the anti-CCP. These are names for antibodies in the blood. Then there are connective tissue diseases that are diagnosed with an anti-nuclear antibody. What is very important to realize is that they should be applied by the and should rescue without a valid reason. So a lot of patients will decide, well, I have aches and pains. Let's go and get tests done. Let's get the arthritis panel done, or let's get me an MRI of the spine because I have spinal pain. So a lot of times the test may be false positive. They may be negative, yet the patient may have arthritis or spondylitis. The MRI or X-ray that you want to get done on your own may not actually see the area which is involved, and that needs to be decided by treating orthopedic surgeon or the rheumatologist, and not by the patient himself or herself. So these are some of the caveats that go into deciding when to get tests done, how to interpret, and this the fact that tests are a dime a dozen these days, and a lot of these panels are so freely available that even patients order them themselves. The fact that these tests can be false positive or can be found positive where they shouldn't be positive makes it very complicated. So in short and brief, history and physical examination, and sometimes tests that are diagnostic. Back to you.
Dr. Sandeep, you're having a little poor internet connection. So if you can switch your camera off and continue to keep your mic on, I think that is going to be better for the signal reception. Yes, because you're missing out on your voice.
Was I
But
lost?
thank you. You were able to complete your sentence. So moving on, my next question will be for Dr. Neeraj. Good morning, Dr. Neeraj.
Morning, good morning.
Good morning, sir. So we have heard all of these rheumatology specialists talk about what arthritis is according to their clinical practicing. You being a spinal surgeon, I'd like you to first of all add to anything that the rest of the three esteemed panelists spoke about of arthritis and the different types of arthritis. And I'd like you to emphasize on the importance of early diagnosis, like Dr. Sundeep was just mentioning about how a clinician reaches a diagnosis. So I want you
Yeah.
to talk a little bit about early diagnosis and how much of an overall impact does it have on the treatment outcome that you have seen practicing
Yes.
all along, please.
So thanks for the opportunity. So first thing is we do see a lot of patients having arthritis. So since I am a spine surgeon, so patients come. Three types of patients usually come to me. So patients with osteoarthritis, rheumatoid arthritis, and third is the ankylosing spondylitis. These
Mhm.
three are the most common types of patients who are coming to me in my practice. So osteoarthritis patients are most common patients. So these patients are usually having problems with degenerative lumbar stenosis, lumbar spondylitis, cervical spondylitis. So along with the osteoarthritis knee. So it's a common scenario. Patient having severe osteoarthritis knee will usually have back pain, and these patients are usually having lumbar class
Mhm.
or they having patients. I think mic is on.
So
Voice
we are
is
seeing
echoing.
some we are seeing some
Yeah,
echo.
yeah. So now it's okay. So second type of patient which we are seeing is ankylosing spondylitis. So these are the patients in which early diagnosis is must. So whenever patients come with morning stiffness, young patients with morning stiffness with axial back pain, we usually get the HLA-B27 done and see if it's positive. Usually, since I'm not a rheumatologist, so I know it's just a baseline test, HLA-B27. It can be positive or it can be negative also. But whenever I see such patients, I usually refer these patients to a rheumatologist. Patients with morning stiffness and axial back pain, young age. So these are the patients. If we are detected early, it's better because the patient because ankylosing spondylitis patients who are neglected, they end up in severe deformities and which are later with complicated surgery. Later they need complicated surgeries and which may have neurological deficits. They need bilateral THR, TKR. So the better is for early diagnosis of these patients. So, and the third type of patient which we see in my practice is the patient with rheumatoid arthritis.
Mhm.
So these patients are also if diagnosed early and if they are sent to rheumatologist. So it's always better because these patients, if they come in late stages, they are having cervical spine problem, upper cervical spine problems, and in which the surgeries are usually more complicated.
Thank you, Dr. Neeraj, for pointing out the importance of early diagnosis. My next question will be for Dr. Shaloo and Dr. Shruti. So let's start with Dr. Shaloo. I would like to learn. Can you share some effective management strategies that you deploy for arthritis, be it medical, surgical, or lifestyle approach changes that you deploy as a clinician? Over to you, Dr. Shaloo.
Hi. Okay, so first of all, though, I would like to say that arthritis is very much treatable and controllable because a lot of times when the patient comes to us, their first question is that we have been told it cannot be treated. So, in fact, I, laughingly tell them that then why we are sitting here if arthritis is not. So, arthritis is very much treatable, and I'll not use the word cure, but definitely we can treat it, and with treat to target management now we can control the disease to such a level that there is no pain, no swelling, and you can lead a very normal life.
Mhm.
So there are a lot of drugs, the conventional ones, the newer ones. Hello. Yeah, I'm
Yes, yes.
audible. Yeah,
Correct.
okay. So there are a lot of drugs available, and each depends on when the patient is coming, how much the arthritis has advanced. Is it just the beginning, or the patient has already developed deformities? Because if the deformities have developed, then treatment would only prevent further deforming deformities, right? If they want to be corrected, they have to be done surgical. So then we refer them to our surgical colleagues. For treatment, we have the disease modifying agents which are available, of which the most commonly used, the oldest ones are methotrexate, leflunomide, hydroxychloroquine, sulfasalazine. These are the drugs which we start as soon as we make the diagnosis of arthritis, rheumatoid arthritis, which is the most common. So I'm talking about that.
Mhm.
And then again, it depends on what kind of patient is coming to us. If it is a young female who's planning for pregnancy, then there are certain drugs such as hydroxychloroquine and sulfasalazine which we use. If not, then we can use the other ones. We tell the patients the pros and cons of each drug, side effects, possible side effects, and how to monitor the disease, and then we start the medicine.
Mhm.
Lifestyle changes, yes, but they are the general lifestyle changes which are applicable to all diseases, like weight loss, regular exercising, avoiding smoking, and the food. That's also a very interesting question. Everybody asks what diet needs to be taken. Here again, nothing special. You need to take a lot of green vegetables, fruits, minerals, foods which are high in antioxidants. All these foods help in healing and probably decreasing inflammation. And there is no specific food which should be avoided. So if you're taking regular medication with your lifestyle modification, you can lead a normal life. That's what I would like to say.
Thank you, Dr. Shaloo. Dr. Shruti, if you'd like to add something to this, along with the same, I'd also like to ask you about any recent advancements or innovative treatments in arthritic management that you're aware of and you would like to talk about them, please.
Yeah. So, ma'am has like almost covered everything, and like what problem she faces. That everyone thinks that arthritis is incurable. So she's right in saying that. Then what are we doing here? So okay, so the theme for this World Arthritis Day this year is "It's in your hands, take action." So this is like I'm super amazed by this. So it's actually in your hands and you need to take action. And the other thing is don't give up on treatment. Today the argument is going to, early aggressive treatment. The treat to target thing is going to address the joint issues and it is also going to address the other comorbidities that are, that come as a byproduct of the disease itself. See, ma'am has already mentioned that we use conventional DMARDs and all these drugs, and the other things that are there are the biologic therapies. So, with advent of biologic therapies, the functionality and of the patient, their activities of daily life, and the time during in which we kind of achieved remission or maybe a low disease activity has been revolutionized. So the newer therapies they consist of biological DMARDs and the most ones that we use is tofacetine. These are the jakinibs. They are also known as oral biologics. So all these therapies they cut short the time during which the patient will have a low disease activity. So all these we use and the other measures that in daily life which can be used is I'll tell the patients to be active because most of them they have a misconception that the more you rest the arthritis will be cured. Other way around. So there should be a graded physical activity and the weight should be under control for that. And these are the majorly newer therapies, the biological drugs and these jakinibs, which every one of us is using, and we have got like tremendous results with that.
Right. Thank you, Dr. Shruti. My next
Okay.
question will be for Dr. Sundeep. Yes, hi,
Hi.
Doctor. So, in your day-to-day practice, I'd like you to mention about some coping strategies that you recommend to individuals to effectively manage arthritis in their day-to-day life and have a fulfilling quality. What do you suggest, and what have you been suggesting? Please.
So the coping strategies include rest. The patient should get enough rest. I ensure that the patient who has features of depression, anxiety, who's not sleeping well because of the pain, gets either medication that takes care of this problem, or have him take medications that will help him with depression, poor energy levels, and fatigue. These coping strategies are also part of your own treatment plan. And then there are coping strategies that the patient needs to do. So, if the patient has a very high stressful week, I recommend that they take a day off in midweek. I recommend patients to take 8 hours of sleep without fail, whatever the outcome of the next days, even if it's an exam, if it's a presentation. But these are things that I ensure that the patient does. The most important coping strategy will always be, ensuring a good environment around yourself, ensuring that your spouse, your children understand your debilities, your problems, and they engage with you in activities of day. For example, if you have morning stiffness and you wake up in the morning feeling tired, feeling stressed, back pain, most arthritis patients and spondylitis patients have maximum problems in the morning when they are supposed to be up and about, cooking breakfast for their children or for their spouse, or driving to work, going down the stairs, lifting weights. Uh, so the morning time, then I ensure that they get the kind of rest that they deserve. They ensure that the family helps them with the most difficult time, and they're spared or allowed to be um, doing more of their chores later in the day, evening, rather than getting up early in the morning. So that's another coping strategy. I enlist them, and I encourage them to enlist in some kind of uh, family of internet providers who make a family of, say, patients with rheumatoid arthritis, patients with ankylosing spondylitis. They have a website where they post what's happening to their treatment, what's new in the field, how they are coping with their problems, and sometimes just exchanging notes of this kind is very therapeutic, and it helps the uh, sufferer to reduce pain and discomfort, and feel less traumatized. Apart from that, I encourage them to keep um, a diary of sorts, which ensures
Okay.
that most of their chores are defined for each day, each week, and they're not rushed in the last moment. They don't have stress because of poor planning. I always have their secretaries or business partners or other people also engage on such matters, and try to have them, uh, devolve all their minor work to their secretaries, making phone calls unnecessarily, ensuring that their appointments are done, things that a secretary can do it for them. So I try to engage them into things that are only essential and find time for themselves. And which also brings to the point that a new hobby is something that I encourage them to do, something like cycling, swimming, uh, which sometimes is very good for the spine and the knee joints. I ensure that they always are on top of the game, not just by being well informed, but also uh, ensuring that they don't lose out on their appointments. I try to have them called back for their appointments if they've been missing their appointments very frequently. So these are some of the usual ways that I encourage them to cope.
Right.
But most importantly, if they have psychological symptoms, a counselor, the need for a psychiatrist, if they have difficulties at workplace or at home, and even family counseling for agitated patients who have very young children with arthritis. So
Okay.
that's some of the coping strategies.
Right. Thank
That,
you. Thank you, Dr. Sundeep. Dr. Neeraj, my next question will be for you. Being a surgeon, what are your opinions on the different management strategies for arthritis? And put some light on the surgical solutions, and when does a patient is required to reach these surgical solutions, if at all? Dr. Neeraj, you're on mute.
Yeah,
Yes, you're audible, sir. Please.
yeah, sorry. So most of the topics, most of the things have been covered regarding conservative management by the speakers, and Dr. Sandeep has elaborated very nicely. So the first thing is, for any arthritis, for any patient who has come with back pain, neck pain, or for that matter any spinal issues, initially first thing what we try to do is the lifestyle modification. So lifestyle modification is the same thing what Dr. Sandeep was saying. So we'll ask the patients to do some change in the lifestyles. So we ask them to do morning walks, the daily morning walks, then some back strengthening exercises and isometric neck exercises. These are the two main important things which we are discussing with our patients. So who are in the early stage of spinal or illness. So exercises are the must. So, but whenever the instability symptoms are there, or when the patient comes in severe pain, or there are neurological deficits, so that there are very few indications for surgery. Most of the patients of any spinal illness can be managed conservatively only.
Okay.
So most of the patients with arthritis. So the patients who are having neurological deficits or claudication symptoms, who cannot walk for short distances or less than 100 meter, and they are having numbness in their legs, and they cannot walk, they cannot stand for more than 5 minutes. And moreover, they are having, apart from this, the patient who are having ball bladder symptoms, having difficulty in passing urine because of lumbar canal stenosis. Those are the patients we offer the surgery.
Right.
So, but if these patients are, if the patient take opinion in the early stage of the illness, they can modify their illness. If they do exercises, back exercises, and modify their lifestyle, stop smoking, control blood sugar. So these symptoms can be avoided so that we can avoid the complications. But if the patient comes in the late stage, we have to go for surgery for these patients. And similarly, in the cervical spine, if the patient is having severe cervical canal stenosis, and patients come with myelopathy symptoms and difficulty in walking, there is instability in gait, and patients with weakness in upper limbs or lower limbs, and unable to having ball bladder symptoms. These are the patients who need surgery.
Thank you, Dr. Neeraj, for elaborating the different surgical answers that people would have. My next question will be for Dr. Shaloo. Dr. Shaloo, as Dr. Sundeep just mentioned about creating some coping measures and strategies, I'd like you to comment and discuss about the support systems and the resources that are available to help individuals with arthritis lead a fulfilling life.
Hello.
Yes, am I audible to you?
Yeah, sorry, the voice got disconnected. Can you repeat the question, sir?
No problem. I wanted to ask you and discuss about the support systems and the resources that are available for individuals with arthritis to lead a fulfilling life. Let's talk about that.
Yeah. So coming to the support system nowadays, there are a lot of awareness programs going on. In fact, a lot of patients have also made support groups which can be looked into. I don't know the specific names and everything, but we have a lot of awareness groups which are available on YouTube and other platforms which the patients often know and they can avail. From our side, the Indian Rheumatology Association, they have a patient care support system where all the education material is available, where you can look for where in all the states all over India which doctors are available, how you can reach your doctor. Then there are specific patient education materials which you can download and know according to your disease. Here, I would like to say that a lot of people Google their diseases, which is quite dangerous because a lot of them, when they come to us, they are, half of them are in kind of a depression that we have a disease and now it's end of life kind of a thing. And then we have to really explain them. So I think the biggest support system would be the doctor direct. So if you are in touch with your doctor and your doctor can empathize with you, that is the best thing, who can tell you about your disease. So I always tell my patients that initially I tell them in detail about their disease, because I feel if the patient knows about the disease, half the battle is won. So if you
Right.
know your disease, you can take care of yourself. You can avoid listening to people ki iska to ilaj nahi hai and all those kind of things. So you can treat yourself. So and then I tell them that you can go to the Indian Rheumatology Association, look for the information, and still if you have any doubt, call me or text me. That I give them that liberty, but do not Google. So I think that is very important. And other resources, yes, definitely we on our end try to help the patients in whatever way we can, that where the medicines are available, how you can get them at a less appropriate cost, so if there is a financial burden. So these are the things we need to take care of.
Thank you. Thank you, Dr. Shaloo. My next question, Dr. Shruti. As we were just discussing with Dr. Sundeep and Dr. Neeraj about the coping strategies that they deploy, I'd like to hear your opinions as well about the different coping measures that you suggest patients or have seen to be causing an impact in the overall treatment modalities that you deploy. Please, Dr. Shruti.
Okay, fine. So one thing that I tell people is to join support groups, right? So they feel
Mm-hmm.
actually quite calm down when they hear stories of other people also, right? So they think that their suffering is probably less or more, whatever they howsoever they take it. But meeting and talking with someone, they become more open to treatment also. When they hear a success story, it becomes easier for the doctor to tell them, right? Yes, this works, and they are better off with that. The other thing that I tell them to, like what happens during arthritis, a lot of people, they give up on their hobbies. Like if
Mm-hmm.
someone does a gardening, so I tell them never to give up on that, because that takes the fun factor from that go. So then they are just concentrating on the disease and the disability that it brings. So if someone does gardening, so we can have a lightweight hose pipe, or maybe kneelers are there. So we our job as a doctor is to ease and provide comfort to them in their activities, rather than tell him to leave. Okay, if this is your hobby, leave it and do exercise or do that. So so the patient, our job is to make them comfortable. So I always tell them to carry on with their hobbies and improvise it. The other thing that I always tell my patients is, like, in their activities of daily routine, like changing of clothes is a very big problem for patients, because they require assistance in that. You have to
Right.
wear a t-shirt and just do it. It becomes difficult and embarrassing for them. So I always tell them to use the zippers, okay,
Hmm.
and maybe some, like, a shirt which has a buttons in front. So there are buttoning aids also. There is Velcro, so you can
Right.
tell them to just get that. So it makes their life much easier because they feel independent with it. The other
Correct.
thing is, I always tell them to have, rugs and carpets, because arthritis is a problem, but then falling with it is another problem. So I
Hmm.
always tell them, so they should have, handway or support system when they get out of bed, and have these carpeted areas just with the bed. The rug should be placed so even if they fall, they get a syncope or something. When they are getting up, they tumble over. So they do not get a fracture with that. And
Right.
just one thing that I always tell them is never to lock the door or washroom door and avoid slipping. If you can't do anything, please don't slip.
Hmm.
Yeah. So these are the other things, and rest everything has been discussed. So these are my personal secrets that I tell to the patient.
Thank you. Thank you. Thank you, Dr. Shruti, for sharing that. Moving over to the next part of this conversation, my question to start with will be for Dr. Sundeep. Let's talk about some variations in the prevalences that we see. So I'll frame my question in a way. As we know that there are some notable regional variations as well as prevalences according to socio-economic areas, urban, rural, age groups. So I want you to talk about the different variations in arthritic prevalence that we see in India, and how do you feel that they impact the healthcare delivery for the overall arthritic care? Please, sir.
So first and foremost, it's mostly socioeconomic status and nutrition that has a major effect on musculoskeletal health.
Okay.
Vis-a-vis differences between, say, a place in Delhi or a place in remote village in, say, Haryana. So
Mm-hmm.
as a genetic population or as a set of individuals, we are not so far apart, so diverse that the heterogeneity is based on you get A disease in Maharashtra and you get B disease in Bengal and you get vice versa. That amount of heterogeneity is not there. The heterogeneity is mostly based on the musculoskeletal health of the patient, who, if he or she is a city dweller, will have problems of plenty, overweight, diabetes, and the like. And if it's a village dweller, you're likely to have problems of, say, poor nutrition, anemia. Women who've had multiple pregnancies have had, deficiencies of calcium or poor food intake. So it's not really a difference of diseases. We tend to see diseases everywhere. If it's a given disease like rheumatoid arthritis, uh, I'm as likely to see a rheumatoid patient from Bangalore city as I am likely to see somebody from, say, a very small town near Kakinada in Andhra or Telangana, or a village in, say, Bhilai. So it's not the differences of genes which make a difference in the arthritis that we see regularly, although they should. But given that there is so much of intermingling among Indians, and we see a few examples of, say, lupus being SLE or lupus being more common in the Northeast, patients with kidney diseases and lupus from Telangana, Andhra being more difficult to treat than, say, from Haryana. But those are very subtle differences, and they should not matter to the audience that we're speaking to. Uh, they're part of research agenda, and they're not really valid for our discussion. What you probably meant
Right.
is how different are patients who come from village backgrounds versus rural, from city backgrounds. So I said very commonly our city dwellers are very often pampered. They are overfed. They have diabetes. They don't exercise so much. Whereas our village dwellers, they per se have to go to the village fields, work their fields, earn their money through manual labor, and they have therefore less of problems that would relate it to age. But
Right.
precisely for that, some of the diseases like disc prolapse or lifting heavy weights are likely to happen to younger people who work in the farms and fields and are manual laborers. But that is the only set that is different. By and large, we've reached a stage where uh, the awareness of rheumatoid arthritis and ankylosing spondylitis, it has gone down even to the basic village level, and people are finding their tests and reaching out to doctors in the cities, and there's not so much of a difference of real arthritic diseases when it comes to city versus
Okay.
village. So if that
Mhm.
was your is that
Right, right,
your
right. So, Dr. Sundeep, thank you for that. One another question that I'd like to add right here is: do you feel there are any specific challenges or barriers that may exist in certain areas of India when it comes to providing quality arthritic care, if any?
So there is certainly several barriers. One is most musculoskeletal experts and specialists in rheumatology, for example, even orthopedic surgeons who trained for higher orthopedic surgeries are mostly in the cities and maybe tier one, tier two towns. There certainly are a dearth of specialists in the villages and small towns, and therefore uh, the tier one, tier two specialists are overburdened. Get patients from the remote villages, they get patients from smaller neighboring towns, and they're overworked. And there's a likelihood that they're not able to give that kind of time and attention to each given patient. And what has turned out is that many a times treatment is based on just a set of few tests, panel tests, or a rheumatoid factor that is positive. And I don't blame the doctors. I blame the overall system where uh, the concentration of doctors is all in the big cities where it's more expensive to get an appointment, to travel, to get tests done, and to get the kind of treatment. So the average patient will flock to the nearest specialist, who may or may not be that well trained and is likely to have minimal training, is likely to over or underdiagnose and treat with medications that are not necessary, or opt for surgery when it is not required. Uh, so that's one of the major problems with smaller towns and remote areas. Uh, it's certain that in the cities it's the other way around. We are having a problem of plenty. The patients go from one doctor to the other. They take an opinion from Doctor A in, say, South Delhi, then they go to Noida and they get another opinion. And it sometimes becomes so difficult for the patient to make an opinion after so much of doctor shopping that they skip treatment or they miss treatment because there's so much around that they don't even take what is available and should be taken with both their hands. So that's another problem with city practice. There's too many specialists and too much of competition for the patients. And surgeons, for example, sometimes decide to operate at the drop of a hat because what they feel is that if I as a surgeon don't operate on him or her now, the patient will go to the next specialist who's just on the three doors down. And let's not miss that. So these are things that are controversial. I'm not saying that we are making unscientific or unethical demands of the patient, but sometimes we get a little too urgent in our decisions, which is not
Thank you.
required. So that's part of our setup in bigger and um,
Right.
uh, heavier
Thank you,
centers.
Dr. Sandeep, for talking about, let's say, the challenges or the barriers. Dr. Neeraj, my next question will be for you. As we know that arthritis is requires a multidisciplinary approach. So, in your experience, what collaborative efforts and partnerships have proven effective in combating arthritis, as you see in your day-to-day practice?
No, definitely, I totally agree with Dr. Sandeep as he said that at a drop of a hat, like we shouldn't go for surgery. So most of the patients who having arthritis, patient needs complete evaluation. So the best thing so the most important thing which we have learned in our early medical school days is the history. So history is the most important thing. That we take proper history to understand what is the patient problems. So so all the patients do not require surgery. I totally accept. And sometimes if patient is having pain because of the arthritis, because of his osteoarthritis, because of multiple reasons. Maybe he's having ankylosing spondylitis, that's why he's having stiffness. But at the same time, if the surgeon sometimes surgeon sees a small disc bulge, and they feel that this small disc bulge is the cause of the pain, which we commonly see in our practice. So patient will come and say कि sir बाहर तो हमको operation बताया है, डॉक्टर साहब ने surgery बताया है, but we see that patient pain is not because of this bulge can be only a collaborative factor, but maybe patient is having other medical symptoms also. So we have to be quite sure while taking decisions of our surgery, our indication should be correct, and this in this age of googling and all those things are there, so much of internet is there, so we should be very much particular and we should stick to our indications. And yes, and for that matter, help from our rheumatologist friends is quite useful. So whenever we see that patient is having multiple issues and they are not coinciding with the radiology what we are seeing in our MRI, definitely we take help from our rheumatologist friends. Secondly, the patients with ankylosing spondylitis, which could come with stiffness and morning stiffness and back pain, even though they are having some minor disc bulges, we'll always take help from our rheumatologist friends, because these patients usually get better with medical treatment. They don't require surgery at the early stage. And similarly, similar is the case with the rheumatoid arthritis also. So early opinion from rheumatologist is must, and which will really help the patient. And in the long term, it will help the surgeon also to so that they're having a patient with proper indications in for their surgical work.
Thank you, Dr. Neeraj, for that answer. Dr. Shruti, my next question will be for you. I hope you're there.
Oh, yes, I'm there.
Yes. While we are closing towards the closing of this panel, for all the viewers, I'd like to ask you bust some common myths or misconceptions that people have about arthritis in India through this medium of arthritis awareness campaign that Voice of Healthcare has hosted. I want you to comment on some common myths, some common misconceptions that you have seen and in your experience.
Okay. So the first, foremost, and the biggest, that arthritis cannot be treated. So
Right.
that is one thing, you know. Am I audible?
Yes, you're audible.
Yeah, yeah. So the biggest misconception, that the myth that needs to be broken, is that it is treatable, and the early you ask for help, the the you will be the least sufferer then, right? So first thing is that please seek a professional advice as soon as you see any red flag. All of us have discussed what can be the red flags, why would you doubt that you have arthritis. The other thing is that in the food thing, so when people come to us, so the most common question that I hear is that, can we eat this? Can we eat milk? Can we, sorry, drink milk? Can we eat paneer? Can we eat non-veg? Can we eat this, that? I don't know what. So, to my knowledge, except for gout, there are not many restrictions on the food stuff. But never ever a person has asked me that shall I smoke or shall I quit it? No one has asked that ever. For alcohol also, no one ever asked that is there any restriction on that? But they will just ask like 20 questions about food stuff, starting from rice to ginger to tea and everything. So there are no major, food issues. The other thing is that the exercise thing, like most of the people, they think that, rest is what is required for, treatment. But that's okay. That rest is required for treatment, but rest is not required. The more you are active, the more, your chances of getting better, it increases. And the other thing is, like, a lot of people sometimes say that, okay, I also have similar weight and my neighbor also has similar weight. Then why are you telling me that because of this weight, this thing happened? So, my advice to every patient is stop comparing. There's no comparison. Every book is different. Every individual is different, and different diseases have different impact on different individuals, because there are like multiple factors that play the role into that. So stop comparing with others. That, okay, My friend is diagnosed with rheumatoid and she goes swimming daily, but I am on bed. There's no comparison. So, and one more thing, that most of the patients, they are in denial when they come to us, right? So denial is not the way to go. Acceptance is the way to go, because when you accept and embrace, then you are more open for the treatment and other things. And the doctors are there to help you in it. They are not dictating terms. They're doctors. They're not dictators. That, oh, you have to take this, and you'll be okay. That kind of thing. Yeah,
Right.
these are the major
Uh,
ones.
Thank you, Dr. Shruti. Another question that I'd like to ask you here: any ongoing public health initiatives that are focused on arthritic awareness or arthritic support groups that you are aware of and you'd like to educate our viewers about it?
Okay, fine. So, see, there are many groups in India also, but mostly when people they, because you know these arthritis group support systems, they are generally searched for and joined by really highly educated group that we see. Okay, so in India, there are Arthritis India, in which they have all this information for these exercises and all. Then there is a scleroderma health group also, and arthritis support foundations are there. So, you know, these have to be actually searched according to the locality where the patient is residing. So it's not that difficult either. You just Google it and you're gonna get it. But mostly, I have seen that people they join these support groups abroad rather than here. Here, their main advisors are their neighbors and their work partners. So, like, yeah, Mission Arthritis India, even the IRA website, our official website, also has a lot of information about it. And there are many ant-spawned support groups also, especially in the diseases where the biologicals are used. So, those support groups are there.
Thank you, Dr. Shruti, for putting some light on there. Now, as we move towards closing of this panel, I'd like to start with Dr. Shaloo. Dr. Shaloo, I hope I'm audible to you. Yeah, you're on mute. Yes, Dr. Shaloo. Can you hear us? Okay, appears that she's having some sort of internet.
Hello.
Yes, Dr. Shaloo.
Yeah.
Yes.
Yeah.
Yes. So as
Hi.
we are moving towards closing this panel on arthritic awareness, one last take-home message that you'd like to impart to all the viewers who have joined. Let them be, patients, your fellow colleagues, or some caregivers who are watching this episode. A message from your side to all the viewers out there.
Yes, so I would like to say the first thing, like as the theme says, it is in your hands, so take control of it. So if you have any of the symptoms, like the whole hour, what we have talked about, joint pain, swelling, unexplained fever, rashes over the body, oral ulcers. So all these indicate you have some kind of autoimmune problem. Visit your local doctor if you're not able to reach the rheumatologist. And I'm sure nowadays all the physicians, all the primary caregivers, they know about rheumatological diseases and they can refer you to the right person. And with the COVID nowadays, we have an added advantage of online video consultation. So if you stay in a remote area, that is also a possibility there. And so first thing is to accept that you have a disease. Second thing is that I would like to assure that if you are treated at the right time, you can lead a very normal life like other person. That's all I would like to say. Thank you
Thank
so
you,
much.
thank you, Dr. Shaloo, for that wonderful message. Dr. Neeraj,
Thank
moving over to you, your key take home on this arthritic awareness campaign that Voice of Healthcare and Pfizer have initiated, please.
So the message which I want to give is that early diagnosis is the must. So whenever you are in trouble and any pain for more than 2 weeks, 2 to 3 weeks requires attention of the doctor. And early diagnosis is must, and early diagnosis and in early treatment, lifestyle modification is must. So if diagnosed early, so things can be managed in a more efficient way. So in lifestyle modifications like stopping smoking, doing exercises, daily walk, and decreasing stress, all these things, if we are done and if we are done and managed in early part of the illness, can definitely stop the progression of the disease. And whenever, as a surgeon, I can say whenever we see such patient, we should always take friend from our rheumatologist friends, because some there are diseases like ankylosing spondylitis and rheumatoid arthritis, if they are treated at an early stage. So I will not say that we can things can be cured, but yes, things can be in control. We can
Mhm.
avoid the complication, because the surgical, when the patient land up in the late stage with neurological deficits, or patient with ankylosing spondylitis when they come with spinal fractures, so those cases are very complicated. Chances of neurological deficits are more. So the complication rates are very high. So it's always better to diagnose early and do some lifestyle modifications.
Thank you, Dr. Neeraj, for that wonderful message. Dr. Sundeep, over to you. Your key take home from this 1 hour discussion on arthritis, sir.
So, like everyone is speaking about ensuring that if you have problems, go to a specialist, or at least go to your physician, who will then redirect you to a specialist. If there's the slightest hint of a real arthritis, if these joints are swollen, you're in the 30s, 40s, you're a young mother, you are around the time of menopause, certainly that is a sign of arthritis, and you must go to a specialist. If you're a young man in the 20s, 30s, and you have a lot of back pain, you can't stretch, you can't turn sides at night, you wake up stiff, you might be having a spondylitis. Go to a specialist. And certainly don't be negative about medical treatment. This misconception that arthritis doesn't have treatment is incorrect. This misconception that English medications have side effects and they cause more problem than good is incorrect. Using over-the-counter medication and some non trained physicians from alternative medicine. So there are a lot of quacks in the market in this space who dole out powders and quick remedies should be completely avoided. Go to an authorized medical personnel. Even if that happens to be from the alternative medicine, it should be somebody who's trained in that space. And certainly avoid any of that drugs those
Right.
powders or powders. That should be completely avoided. That's very bad for health. And optimism is most important.
Okay. Thank you.
Medicine
Thank you, Dr. Sundeep.
are great. Yes. Thank you.
Yes. Thank you. Moving over, Dr. Shruti, your key take-home message for all the viewers, everyone who has engaged with us for this arthritic awareness, please.
Okay. So I think it's all complete only. Only thing that I would like to add is don't ignore. See what happens, all these diseases are mainly, they occur in females mostly, and they try to ignore it for the sake of their household, many reasons. ऐसे ही हो जाएगा, ठीक हो जाएगा. Okay. So every step is second. The first step is to identify the problem itself, that it can be something which requires attention. Going to a doctor is a second step. So first, my message to everyone is, please identify your problem, give importance to that, and don't ignore it. All these steps
Right.
are after that. Even if you have a rheumatologist like as your neighbor, you won't go till you think that okay, this is not a pain given to you by your mother-in-law. It's an arthritis. It needs to be treated. So it's
Right.
like you need to identify it first. So just don't ignore the symptoms. At least be watchful about it, and then the further, like everyone other has mentioned.
Thank
Thank
you,
you.
Dr. Shruti. So, with this, I'd like to bring this session to a closure. I'd like to thank all the viewers. I'd like to thank Pfizer for powering this session, and I'd like to thank my
Thank you.
esteemed panelists, Dr. Sandeep, Dr. Shruti, Dr. Neeraj, and Dr. Shaloo, for sparing time in the early hours of your OPD in creating this awareness campaign with us. I thank each one of you, and
Thank you.
thank you for stepping up. Have a good day. Thank
Thank
you.
you.
Have a good.
Thank you.
Thank you.
Okay.